This is Dr. James, and please, if you like the way that I teach and inform people, check out my book. It's called The Big Book of Why. It's on Amazon and Barnes & Nobles. But the thing I want to talk to you about today is around 15 to 18 months old, a baby will start to sometimes just go on a hunger strike where they just don't seem to act like they want to eat. And parents just freak out. I have a lot of parents that come in thinking that their baby's just going to starve to death. And I would just like to say that I have never lost a baby, but it sure has seemed like I've gotten close to losing some parents over the years. This is completely normal. Around the time 15 to 18 months old, they change the way they grow. So instead of having perfectly linear growth, where they're growing about the same amount all the time, they start to grow in spurts. Most of them will have somewhere between 2 and 4 spurts per year. They'll usually last for a week or two where they'll just be ravenously hungry and they'll eat you out of house and home. A lot of times these little small children will eat more than their moms during this period of time. Then they go on a hunger strike and they'll live all day on a glass of milk, a cookie, maybe a cracker. And they'll do this for weeks at a time and you're just going crazy. Well, during this period of time, their metabolic rate goes down and they just don't need as much. But when they're having a growth spurt, their metabolic rate is very high and they need to eat a lot. So as long as your baby is growing fine and your doctor is not worried about their development or their growth, when these things happen, remember that as a parent, it is not your job to force your child to eat. It is your job to offer a good variety of stuff. When they need it, they will eat it. And when they don't, they won't. But don't punish them. And for God's sake, please do not get into the mindset that food is something that is to be rewarded and that you're good if you eat a lot and that you're bad if you don't eat anything. Food should be something that we eat because it's a necessity and we need it at that time. The worst thing we can do is to get this into some kind of reward system. That's a bad thing psychologically, long term. And we want to eat enough. We don't need to eat in excess. And babies and small children are really good at this. And when it starts, get used to it. It's going to last a while. They probably aren't going to eat the 3 squares a day until they probably get in school. And they're still probably not going to eat as many vegetables as you want them to. But these little small children, when they start going through this, don't freak out. They're going to be fine. If there is something to worry about, your doctor will tell you about it. They'll find it on their growth curve, and they won't be developing normal. So that's not all true for all children. If you have a problem and your doctor's worried about it, that's different. Those babies we need to work with, and we may have feeding therapy. But for your normal baby that's growing and developing normally, they're going to have this happen, and just accept it. They'll be okay. Take a deep breath. You'll both make it through it.